Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
of hyperlipidemias. First drug is HMG-CoA inhibitors, whereas the second drug is we have cholesterol absorption inhibitors. Cholesterol absorption inhibitors, as the name says, they will inhibit the absorption of cholesterol. Because they will inhibit the absorption of cholesterol, they will also increase the LDL receptors. So these cholesterol absorption inhibitors, because there is decreased absorption of cholesterol, obviously the total cholesterol level will be decreased. So it is used in conditions where there is elevated LDL cholesterol. And the side effects of cholesterol absorption inhibitors are it can result in elevated transaminases. Then the next drug is we have bile acid sequestrant. Bile acid sequestrants which can be used are we have cholestyramine and cholestyramine and cholecalciferol are used. So all these will have these will cause these are bile acid sequestrants. They will increase the bile acid excretion, and these also increase the LDL receptors. So thus, because they will increase the bile acid excretion, cholesterol is excreted out. So as a result, it is used in conditions where there is elevated LDL cholesterol. And the side effects of these bile acid sequestrants are it can result in bloating, constipation, and elevated triglycerides are reported.
thank you and thank you for watching.